if I talk about it from a doctor's medical point of view, and then I'm going to throw it over to Eleanor and Sue, because there's a whole range of different things that you can do. So the first thing to say that most of these symptoms in the perimenopause and menopause, and yes, these symptoms can start really early in the menopause transition. It's down to the loss of estrogen, or a general lack of estrogen and you need estrogen to keep the tissue of the vagina, keep the tissue of the vulva healthy. And with a loss of estrogen, it can become delicate and more sensitive. And so it makes sense that adding back estrogen will help. Now, systemic HRT, that's HRT as tablets, patches, gels, etc., sometimes isn't enough to help. And about a quarter to a third of women on HRT also need vaginal estrogen. And actually, if your only symptoms are vulval or vaginal, you sometimes only need a vaginal estrogen to sort them out. So if you have a look on our website, I've listed absolutely all the possibilities, but basically they boil down to pessaries, little tiny tablets that go into the vagina, or creams. There's a gel, or there's a vaginal ring that your doctor can fit, and that can be super helpful. So I would say first stop is estrogen, to keep the tissue healthy, to keep it well lubricated, to keep it stretchy. But I know that there are also non-hormonal things that you can use as well as vaginal estrogens, which, Eleanor, do you want to talk a little bit about the products that you recommend to people as well?
Yeah, and I completely agree with what you're saying, Claire. And I think it's really important, if you have that conversation with your doctor, to get the right prescription and possibly try different forms of the estrogen if one doesn't suit you, and try the other. For non-hormonal options, you've got vaginal moisturisers, which are going to be more to maintain day-to-day comfort. So they are just delivering water to the tissue. So whereas the HRT is re-estrogenizing the system, which introduces the natural lubrication, what a moisturizer does is just deliver water back to the tissue. And it's for day-to-day use. You can use it alongside your HRT. So if you're using something like Vagifem and you're finding on day 2 or 3 you need something else before you take your next dose, then a moisturizer is perfect to work alongside that. Lubricants are then going to be additional lubrication for sex. There are some ladies like to use their lubricants more regularly for comfort, but actually they are designed to deliver a lot of moisture over a shorter period of time for sex. So a moisturizer is going to be better to deliver moisture over a longer period of time. But when I started researching this, and the thing that we all need to be really aware of is that formulation with these products really does matter. And for a long time, there wasn't enough thought put into lubricant and moisturizer formulation because they were designed to be cheap and slippy, but these big companies didn't really think about what was good for gynecological health. So there are plenty of ingredients that you might be familiar with because they're in your cosmetics and that they're okay for normal epithelium. But it's remembering that the vulva and the vagina is made of a mucosal tissue, and it needs a really different set of ingredients. So the thing I would always say, I can talk about the Yes products, but the thing I would always say is look at the ingredients list. We want to avoid the big molecules, the glycerin, glycols, things that are going to have a sugary base and encourage thrush. We want to avoid mineral oils, parabens. So having an open ingredient policy on the lubricant you're using is really important. And if you're unsure, to chat to your doctor about it. I can talk obviously with confidence about the Yes range, knowing them. So just quickly, the vaginal moisturizer, which you might be able to see is in the white. Now you can use that. It comes either in the tubes or in little applicators if you want to deliver it higher up. And that's going to be for day-to-day use. And then the lubricants, which they have, are the oil-based lubricant and a water-based lubricant. And the difference there is going to be a little bit about personal choice. An oil-based lubricant will last longer, will really protect tissue, especially if there's microabrasions or the tissue's quite friable. So it's really nice on the vulva if you've got irritation there. But it won't hydrate the tissue because it doesn't have a water content. And the water-based lubricant is a really lovely, naturally feeling lubricant. So you won't notice it's very like natural vaginal secretions. And they can be used together. So you can put the oil underneath and then the water on top or on a partner, and then the two will slide over each other, which is a really nice combination that Sue might recommend. But I'm very conscious that I'm whizzing through that a bit. But I think yes is, you know, I work as an ambassador for them, but you know, they do have a very open ingredients policy on their website. So it's really about finding what suits you, but really trying to do a bit of research before, because they're not all lubricants aren't created equal. I think that's the thing to remember.
I think as we prepared for this session, I've learned a ton from you guys over the past couple of weeks and talking to you. And then Eleanor, I know, and Claire, you mentioned as well, I think that some of the ES products are available on prescription as well. Is that right?
Yes, they are.
I know you're making a face, Claire, because doctors, you know, don't like prescribing them, but it's important, I think, for our listeners to know.
Yes, no, absolutely. The only reason I'm making a face is your GP may not prescribe it for you. There are different rules, different practices have different feelings about things that you can buy over the counter. But no, absolutely. I think the Yes products are absolutely great. The oil ones tend to last longer. You just have to make sure that if you're using a condom for contraception, use oil-based ones, can rot condoms. There are other brands out there, so you might have come across Silk. There's the Durex range, but again, some of them, if you look at the ingredients, as Eleanor said, some of them have more tingly bits, more sugary bits. And also what Eleanor didn't mention that we talked about before, it's really important as to what sort of wash you use. So if you imagine, I've talked about that really delicate, thin tissue that's prone to tearing, and soaps can be a shocker on your vulva, and you really want to use soap-free washers, which I'm not sure. Do Yes make one, Eleanor? I can't remember.
Yeah, so they do a vulval cleanse. And again, really important that when we think about washing, that we're not talking about, we really want to avoid feminine hygiene products or anything that's branded because you want your vagina to smell different. Certainly no internal washes. The vagina has a very diverse microbiome. So we think of the gut microbiome, and we talk about that a bit, and drinking our Activia and all that sort of thing. But the microbiome of the vagina is more diverse than that of the gut. And we really need to protect that. So that creates a self-cleaning mechanism in the vagina. So internally, the vagina is really good at looking after itself. What you want to avoid is using on your vulva, so externally, using any shower gels or perfume products that are really going to strip the natural oils of the vulva, especially if postmenopausally you're starting to feel that tissue is more friable because of the lack of estrogen. So it's about avoiding perfumed products, avoiding things that you might be happily using on normal epithelium. So by that I mean the skin covering the rest of your body, and remembering that the vulva is that much more sensitive. So yes, do a really lovely, gentle, non-perfumed wash. But I know that a lot of the dermatologists I work with like to recommend an emollient that's quite, any standard emollient that would just help sort of protect the area rather than strip it of the oils. So again, I think it's just, if you're unsure, just checking with your healthcare professional, but follow some basic rules, nothing perfumed, nothing, really considering what you put on that area. We maybe think about it for the rest of our body, but actually our vulva is going to be more sensitive than other areas of our body.